Hey there, my little chickens. So the other day a patient came to me in a state of worry. He believed he had a cervical hernia. I reassured him saying, "Don't fret my friend, let me explain it to you. In essence, what we're dealing with here is cervical radiculopathy. It's a condition brought about by dysfunction in the nerve roots of the cervical spine. And one of the most common culprits behind this radiculopathy is the compression of the nerve root. As you can observe, it's quite evident. And this nerve compression has symptoms of pain, numbness, weakness, and sometimes extends throughout the arm, even reaching the hand. The reality is that carpal tunnel syndrome is very common in older individuals, particularly those in their middle age, and the most vulnerable group is usually represented by individuals in occupations with repetitive hand movements. During a recent discussion, a friend of mine revealed that he had been informed about his need for a discectomy and a fusion in the front of his neck. I reassured him not to worry and promised to explain to him the procedure he was going to undergo. This surgical technique is commonly used to treat herniated discs, and it involves creating an incision in the skin, followed by the careful separation of the anterior structures using retractors. On one side, the carotid artery and the jugular vein are delicately moved aside, while on the other side, the trachea, esophagus, and other surrounding muscles are preserved. Additionally, to improve visibility, 2 screws are inserted to create adequate space after identifying the vertebral levels. Now the attention is focused on the affected intervertebral disc. An incision is made in the annulus fibrosus that will reveal the nucleus pulposus. With a spoon-shaped instrument called a curette, the surgeon removes the nucleus pulposus, slowly, carefully, and this action will resolve the spinal nerve root compression. In order to remove all the material from the intervertebral space, a specialized surgical tool called a burr, which is similar in appearance to a drill, is utilized to carefully sharpen the surfaces of the adjacent vertebrae. This removes the surface layer of bone and promotes a more effective fusion between the vertebrae and the graft. The empty intervertebral space is usually filled with a bone graft cage or prosthesis, which facilitates spinal fusion. The implant is carefully placed between the vertebrae, seeking alignment to provide proper stability. Once the implant is placed inside the body, the screws, which were previously used to separate the vertebrae and preserve the space, are extracted. In order to ensure long-term stability and finalize the fusion process, a plate is attached using screws that contribute to balance and stability. Quite a work of art. I could say that it is practically pure masonry. Finally, after carefully removing the retractors, we proceed to stitch the skin incision, ensuring that the edges are aligned. To promote optimal healing and minimize scarring, we apply a dressing. That concludes the procedure, and now only rehabilitation remains. Though it may seem daunting, it is simpler than you may think, but that is a topic for another time. I sincerely hope you found this explanation helpful. If so, consider subscribing and sharing with others. Best wishes for a speedy recovery and beyond. Goodbye, farewell.